name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are excited to be joined by Laurel Pickering, who is the CEO of the St. Louis Area Business Health Coalition. Welcome to the podcast, Laurel.
Great. Thanks, Norm. It's great to be here.
Yeah, we're really excited to have you. For all of our viewers and listeners who aren't as familiar with Laurel as I am, in addition to being president and CEO of the St. Louis Business Health Coalition, she also serves as faculty professor at Jefferson College of Population Health at Thomas Jefferson University. Earlier in her career, before starting this coalition, she was at a couple of vendors in the space, Centivo and Welldoc. And for 24 years, she was leading the Northeast Business Group on Health. So Laurel has a great understanding of how the ecosystem works between employers, brokers and consultants, vendors, health plans, all the stakeholders. And we're really excited to hear her insights on what's going on in the market. So Laurel, welcome.
Great. Thank you.
So I ask everyone, what inspired you to get into the healthcare field?
Well, I don't have a story about someone close to me being sick or having a challenge with the system.
I'm glad to hear that. Sadly, that's the exception, not the rule, but that always is a good reason that it wasn't a bad situation.
No, and it actually came from my decision not to be an archaeologist.
Okay.
Which is probably not an answer you were expecting.
Not. Do you have any regrets of not going into archaeology?
I don't. And, I did go into college majoring in anthropology and archaeology. Mm-hmm. You're probably too young for this, but I lived in the New York area when the King Tut exhibit came to the Met. My parents took me and my brothers, and I was blown away. I was like, oh my gosh, this is so fascinating, and this is what I want to do.
Yeah.
When I went into college and I went on a dig in between my sophomore and junior year, and the dig was in upstate New York, excavating Iroquois Indian villages, clearly not King Tut. And there are no Iroquois Indian villages in upstate New York. If you think about it, it's all like, it's in the earth. It's all hidden. It was extremely tedious, very, very tedious. And I decided that I don't want to be an archaeologist. But what I fell back on was medical anthropology. And medical anthropology is the influence of culture, on things like health or illness. And it really led me to public health. And, I had always had this orientation toward helping people and wanting to help those less fortunate. I went into public health, but Norm, the real inspiration came from what I learned about employers and the leverage that they have to influence the system. And I know we're going to talk more about that. But when the system makes a change because an employer pushed them to do that, it changes for everyone. Right. So when Disney directly contracts with Advent Health and Orlando Health, and they don't just change how they practice medicine for the Disney employees, they change it for everybody. And when I learned about
Barb, who I know is instrumental in that.
Yes. And I know Barb, and she knows this. Right. So when I learned about employers and the leverage that they can have, it changed everything for me. And, I built my whole career on that, using leverage of employers to change the system.
I love it. So every dig site is not as exciting as it looks in Indiana Jones.
Not at all. You spend your whole day with a little shovel, like scraping the dirt.
Well, I really respect the patience and the optimism that archaeologists have, because I'm sure a lot of it is not super exciting. And then, you have those magical moments a couple of times in your career.
Yes.
So walk us through your 24 years as president and CEO of Northeast Business Group on Health. What was it like in the infancy, and, kind of what did it transform into, by the time you left in 2017?
Yeah. So, when I started as a research assistant, sort of fresh out of graduate school, you were actually in financial trouble. And the board was considering closing the doors of the organization. We only had a couple of employees. The executive director at the time had left suddenly. And so the board was faced with, how do we go forward? And they ended up, sort of rising to the occasion of stepping up to run the organization while the board was figuring out what to do. And they said, hey, Laurel is running this organization on a daily basis. Why don't we support her to learn the things she doesn't know, like finances? I had a public health background, and that's what they did. So they supported me to run it and grow it. And when I left, we had about 10 employees. That's a lot for a coalition.
Yeah.
And close to 200 members. And we were really the go-to organization for employers in the area and policymakers. And we were very focused on using that leverage to create change in the market.
I love that. Leading Northeast Business Group on health, employer-led coalition. Like you said, there were a ton of benefits leaders and healthcare stakeholders, that were participating through the 90s and 2000s. How has the landscape of healthcare benefits changed, from those early years in the 90s to, where it is now?
Well, it's really fascinating because when I started in the early 90s, we had managed care, we had HMOs, and employers had multiple plans around the country. So wherever they had a population, they had a managed care plan, they had a health plan. I mean, we had some employers that had like 30 plans, 35, 40 plans. And for the most part, it was first dollar coverage, right?
Mhm.
You had co-pays for services when you went to the physician, when you went to the hospital. Well, employers got tired of managing so many plans, right?
Mhm.
And they needed to have to save money. So they turned toward a national solution
Mhm.
and had wanted to have one plan for everyone across the country. Made things a lot easier to administer benefits. When the cost issue really always been ongoing, but when they, needed to figure out new ways to deal with costs, we had the introduction of high deductible health plans.
Mhm.
And it's very much part of promoting them at the business group. We had a lot of educational programs. I really believe that people could be good consumers of healthcare. We could give them quality information and cost information, and they could go and make decisions about where they were going to get care, how they were going to spend healthcare dollars. And frankly, I think what we're seeing now is that has not worked.
Mhm.
People have not become good healthcare consumers. And as a result, Norm, it's like we're going back
Mhm.
to the kinds of plans that we had in the 90s. And what we're seeing now is a shift back to plans that have first dollar coverage, no
Mhm.
deductibles. I mean, we'll get to Centivo, but that's what Centivo is focused on. No deductibles, really looking at affordability because people who have high deductibles they have medical debt. And
Yeah.
we know that they avoid care. There's an article that came out in JAMA recently that showed that people with diabetes had more complications if they had a high deductible plan because they avoided care.
Yeah.
And employers are recognizing this. They're also seeing that healthcare is local. We're seeing a return to what can I do in a local market that's going to improve the quality and the value of the care that my employees are getting. So it's almost, I don't know if it's back to the future, but it's back to the 90s where a regional focus, affordability. I have to say right now, it's probably the minority of employers that are looking at benefits this way. Most are still high deductible plans, a national solution, but
Mhm.
that's where I see it's headed.
All right. You built one of the most active and influential business coalitions in the country. You had members including American Express, Aon, Lockton, Bloomberg, Aetna, Anthem, Cigna, Eli Lilly, Moderna, CVS, City of New York, the NBA, Paramount on one side of the fence. And then on the solutions members side, you had groups like Omada, Hinge, Lyra, Progeny, Vita, many, many others. What was it like to bring all of those different groups together, and how hard was it?
It wasn't so hard to bring the employers. I think they're always searching for networking opportunities and education. Companies were prestigious and the big names really helped us get things done. It was also about the people.
Hmm.
Like, you need committed people that are willing to volunteer their time. And when you look at coalitions around the country, the employers and the people really shine. Those that are willing to be on the board of the coalition, be on the executive committee, make sure it works for the members. But then with all the consultants and the health, like, we were a multi-stakeholder coalition.
Hmm.
Everyone could be an equal member. That's unlike what I'm doing today, which we can come back to. The
Hmm.
balance of putting the employers up front and not letting them be sold to all the time and to balance that with the vendors was definitely a challenge. But the
Yeah,
board was predominantly employers, and it was always employer driven.
that's great. That's where all the change typically will happen. Talk to me about your biggest successes.
I would say the biggest success was getting health plans to work together. And that became our biggest lever to
Yeah.
create change and move the market, right? Because the plans have our data, the plans have the contracts,
Hmm.
and we did a lot of things with the plans. First thing we did is we aggregated their data and did report cards on individual physician quality performance, which was one of the first times in the country that had been done at the individual physician level. So that was one project. We focused on mental health, where we got all the plans together to say, how can we pay for behavioral health care in primary care? Right
Hmm.
now, we want primary care to have behavioral health, right? We want integrated care. At the time, they're like, how do we pay for it? How do you pay for a social worker to be in a primary care physician's office? How do you pay for a primary care doctor to talk to a psychiatrist about what to do about patients? So we brought health plans together to work on how do we pay and support that model. We were also focused on advanced primary care. We were selected by the New York State Health Department to get health plans to collectively pay more for advanced primary care. So really, the getting the health plans to kind of do our work in the market, with the employer's direction, with the employer saying, hey, Aetna, Cigna, United, Anthem, this is important. This is what we
Hmm.
want you to do, and this is what we want you to work on. And that's how you move a market. And those are some of the examples of the initiatives that we worked on, had success.
That's tremendous. And in the Northeast, you have like the most densely populated area of the country. So, I think a lot of things start in the Northeast and then work their way south and west, over time. Any successes that you feel proud of with like vendor and employer collaboration from that time?
Yeah, and I don't know if you're talking about. I put vendors can be providers, they can be health plans, they can be point solutions.
Yeah, I guess
Um,
tech
to
innovators.
Tech innovators. Okay, so this is going back. Yeah, so when I was at the business group, Norm, is when a lot of digital health and the tech community really got into healthcare, and we're very focused on solutions for employers.
Hmm.
And it got very confusing. It's still confusing. So one of the things that we focused on at the business group was putting them in front of the members, giving them platforms, educational programs, but we also developed buyer's guides where we looked at a category, diabetes. It was an early category, right? So
Oh,
we
yeah.
looked at diabetes and we did a buyer's guide for employers and looking at all the same elements and comparing them across. Business group has also done behavioral health. Like, there's a lot in mental health. So really, I think where we landed with many of those tech companies is just helping employers navigate and understand, ROI, value, that kind of thing.
Excellent. What were your biggest challenges at the business group?
The biggest challenges, and this theme may come back when we talk about St. Louis,
Yeah.
is just how massive New York area is. And, you know, as a coalition, you're focused on improving healthcare in the market and the
Hmm.
community. So in New York, where's the community? And this is pre-COVID. Everyone came into Manhattan to work and then went home to New York, New Jersey, Connecticut, Pennsylvania. So
Hmm.
so where was the community? That was challenging, and where to focus. And we had national and global employers for the most part who they were not going to purchase anything through the Northeast Business Group on Health. A lot of coalitions will do group purchasing. They weren't going to purchase anything through us. And they had communities all over the country and the world to focus on. So their investment in New York area was going to be limited to some extent. So I think just the nature of the geography and the nature of the employers themselves made it challenging. And when we talk about St. Louis, you'll see I'll talk
Mhm.
about those things are different here.
Yeah, that's fantastic. After 24 years, leading the Northeast Business Group on Health, what caused you to go over to the dark side and, work for a software vendor, um, and a digital health innovator in WellDoc?
So being at the business groups and the coalitions is the greatest job, but I wanted to experience other things.
Mhm.
I actually looked at other people with envy who had multiple experiences, had worked at multiple organizations, and I wanted that. I
Mhm.
wanted to have varied perspective. I wanted to learn new things. And then I wanted to stretch myself and get out of my comfort zone.
Yeah.
And that
So go to a
that's
startup will get someone out of their comfort zone real quick.
100%. And well, Doc, so it was around the time that digital health was starting to explode, and especially in the diabetes space, as
Yeah.
you've been working with these companies for so long. It was the early condition that we saw a lot of innovation. Doc had what I considered, and most do, like the gold standard of effectiveness. They had a randomized clinical control trial that showed that they could lower A1C. And to me, that was huge, and that was going to differentiate them. And I wanted to learn about digital health. I thought diabetes is a huge area that we need to address, and that's why I was really interested in going to WellDoc.
So that
So,
brings up an interesting point because there's a lot of vendors in now all the markets, whether that's diabetes, whether that's mental health, whether that's musculoskeletal, even things as niche as gastro and caregiving as a benefit. Like there are half dozen competing companies, all in one
yes.
market. So my question is, you hear it a lot like, hey, we have the best solution, we've got the best clinical outcome. But sometimes the companies that claim those things don't end up like dominating a market. So I guess like, what did you learn working for a company that when you went in, you believed like, hey, this is the best solution on the market. That's why I chose it. Like, what did you learn about how vendors go to market in this space and like what works and what doesn't in terms of being able to convey that message effectively?
Yeah, it was, to your point, it was a huge education because going in, I thought it was almost like a no brainer. We
Mhm.
have these RCTs, and it was just at the time that Livongo was exploding. And so
Yeah.
we were competing with Livongo, who did not have a randomized clinical control trial. And I did learn about what it takes to penetrate a market. And it's not necessarily that you have the best science and can show your
Mhm.
outcomes the best. And they put a lot of money into marketing. And they also had a high touch solution. We had an app that showed incredible results, but we didn't have a person that the member could call. Employers want high touch. They want
Mhm.
someone that their people can call. They also had a really nice kit with a glucometer, and people love stuff. They love to get that kit in the mail. I mean, there were so many elements that Livongo got right about
Mhm.
consumers, what they want, what employers want, that went way beyond, the clinical effectiveness data.
Mhm.
I learned a lot. And I think employers are my friends, and I base my whole career off of they do and their leverage. But
Yeah.
they do like shiny objects. And you can package it and make it shiny, and you can win the day sometimes. And I think Livongo did a great job of doing that. And
Mhm.
you don't necessarily need a randomized clinical control trial. They also did get results and they got engagement at the time. And so, kudos to them. They figured it out at then. And yeah, that was a big challenge for
That's
us.
great. So I have a lot of founders that watch this podcast. And when I meet founders, I hear a lot, like I would say over half the time, like, oh, we have the best product in our market, and here's why. A founder that believes that, what advice would you give them? That, like, okay, that's great. That's not enough. That's not like going to clear the bar of like market domination. great you have that, but like, here are the other things you need to consider.
You have to completely understand your target audience
Mhm.
and what makes them buy, right? It's not enough to have the data. And for a lot of them, I know a lot of the companies you work with, Norm, the employers are their target, and then in turn, the employees, right, to get them
Yeah.
to use things. And I
Or health
think,
plans and the health plan member.
or health plans, or yeah. And so it's a twofold sale, right? The employer, the health plan, the member, the employee.
Mhm.
And it's understanding, and it's human nature, like understanding things that humans respond to. And I think Livongo is a great case study
Mhm.
of how they did that extremely well. But it's understanding, what does the employer need to deploy it? You have to make it easy. You have
Yeah.
to support them in it. And for the employee, like, how's it going to grab them? They have to use it. Engagement is the biggest problem with these solutions. You could get the best results all day long, but if nobody uses it, it doesn't matter. So I think engagement is a huge focus on, how do you engage people and get them to actually use it? These are all things that I think, we all know, but I lived it and competed with Livongo, and it was really hard.
Yeah, no, they were a very talented group, and they did a lot of the right things, and there's still companies to this day that run the Livongo playbook to varying degrees of success. And,
Yeah.
there's a lot of people that were part of that Livongo success story that have, now gone on to do other things. And they're like, it's harder, partially because we taught the whole industry how to do what
How
we
to do
did,
it right. Yeah.
that competitive advantage isn't there anymore. So it's, yeah, really interesting case study. And, interestingly, how I started in this space, like they were my first client in this employer sponsored market. So, that was really exciting to be able to see it up close of like why they were winning and learning as much as I could from them. So after WellDoc, you joined Centivo. Walk me through like why you made that decision. What about Centivo, really stuck out?
Yeah. So I really missed, when I was at WellDoc, employers transforming healthcare. As I
Mhm.
said, that's really what I built my career on. And I learned about Centivo. And I thought, and I still think, that they have the right elements to change the market and drive transformation, certainly in the health plan space, but also, in employer sponsored benefits. And what they do is they partner with health systems that focused on value-based care. They marry it with a primary care model where you have to have a primary care physician and you have to get referrals. So get back to those HMO days. You have a plan design that is first dollar coverage, right? No deductible, all primary care is free, and simple copays. But it's very different from the HMO days because now we look at the primary care physician as a navigator of the system and a care coordinator. You
Mhm.
see companies now very focused on primary care, like making sure employees have a primary care physician. And it's kind of like back to where we started. And it's a regional focus, right?
Mhm.
So they're only partnering in certain markets with certain health systems. And that's what new health plans are doing, others that are cropping up, like Exo Health and others. And so
Mhm.
we're going back to think local, regional solutions. Broad network health plans and high deductible plans, they're not working. And
Yeah.
they're in fact hurting us, right? There's unclear quality, there's lack of care coordination, people are avoiding care, they're going into debt, the things that we already talked about. So I absolutely believe, and still believe, that plans like Centivo are transforming the market. And that's why I went there. Like, I wanted to be part of innovation, disrupting the market, going against the status quo, again, getting out of that comfort zone, stretching myself. And that's why I went to Centivo.
Yeah, no, I'm very excited and intrigued by some of the new age health plans, that are sprouting up, like the ones you mentioned. And I also am extremely bullish. I've been screaming it from the mountaintops for a while now, about health plan carve out models. Like the fertility market did really, really well, carving out their
Right.
own networks, the COE and bundled payment companies, that are doing great things in bundling surgeries and, even cancer treatments.
Yep.
That market's really hot. And now I see like there's starting to be other pockets that are starting to pop up. I had Elon Adler in that group at One Imaging on, who's doing that in radiology, really exciting. I've seen a bunch, in the infusion business. There's a bunch of those businesses popping up that we're really excited about. So I do think like starting a brand new health plan and new model is a great idea, but also these health plan carve outs that eliminate deductibles in many cases, or at the very least make them much, much, much lower than the health plan deductibles, are a really good way to get some really nice cost savings in some of the areas that are draining the most cost from the market. Yeah, I think those are both great options for employers. What were some of your greatest learnings at Centivo?
Yeah, and this goes your point about these other solutions popping up. For things to change, or for the market to change, an employer needs to buy differently. And I
Hmm.
think when I went to Centivo, that hit home for me in a way it never has.
Hmm.
Even though I've been promoting employers do different things my whole career, they have to buy differently. And it's really hard to
Yeah.
get them to buy differently. And it's really hard to sell transformation and do the things that you just talked about because it goes against the status quo.
Mhm.
And at least in the case of selling a new health plan, everything has to align almost perfectly to close that sale. You need an employer who's willing to do something different. They need to be willing to take risks. That whole like nobody got fired for hiring IBM, no one got fired for hiring Aetna, United, Cigna. They have to be willing to make the effort it takes to offer more than one health plan and get
Hmm.
out of the national one solution for everyone sort of box. They have to think locally instead of nationally. Once you have all that, Norm, the timing needs to line up, right?
Yeah.
They can't be going through a merger. They can't be putting in a new HRIS system. They can't have turnover in the HR benefits department. They have to
Mhm.
have leadership that's also on board, right? And then you need a
And what's
consultant.
going on in a like leadership group and like with their family members and like who's covered under the health plan, like could squash it immediately. And
Totally, right.
someone has, a cancer diagnosis or something, it's like, oh well, this is great for the whole population, but I want my Aetna or
Not for
United.
me. Right. Right. And we could probably come up with 10 more things, right? But then also you have to have a consultant or a broker that is open to buying differently. And I also learned how much brokers and consultants control whether transformation happens or not.
Yeah.
They perpetuate the status quo, they block innovation, and there are obviously exceptions. And you know who you are, those of you that are listening. There are obviously exceptions. But it just hit home for me, like how hard it is. And I didn't appreciate that until I got to Centivo and really tried to sell transformation.
Yeah, no, it's extremely difficult. It's not for the faint of heart. I've asked a bunch of people on this podcast this. How can we incentivize benefits leaders and benefits consultants to take more risk?
Yeah. Fortunately, you always have to show like what's in it for them, right?
Yeah.
You have to lead with that. And maybe we haven't done the best job doing that. You always have to lead with what's in it for them. And you have to show them examples of where the sky didn't fall, and it
Mhm.
actually had a good outcome and a good result for the employer and the employees. So what we do is we lean on those innovators, right? Those that take risks. And you and I can probably like list them on two hands, who the companies
Yeah.
that we're talking about. So we lean on those companies and then we say, share your story. I think the more companies we have, you have to share the story. It worked out. We save money. Our employees are getting better care. And the consultants, I think they need to be pushed by their clients. I think, Aon, Mercer, WTW, Gallagher, Lockton, US, like there's a core that we can call out to say, hey, you all can do a better job as a company with your consultants. I know every shop is different, whether it's Wisconsin or
Yeah.
St. Louis, or I think they have leaders in those organizations that believe all this. They could do a better job of pushing it down to the local offices and really saying, hey, this is a priority for us.
Yeah. Well, I would say it, also comes down to the leadership of the large employers and what are they doing to the benefits managers that do outperform their competition, like outperform their peers. If it's just a pat on the back and maybe like a little email like, hey, congrats, they saved us, 100 million bucks, the upside's not there. If it's like, hey, you'll get promoted, you'll, have bonuses based on performance, like I really believe strongly that companies have to start compensating their benefits leaders based on, are they able to show that they're reducing costs or improving access or improving clinical outcomes or reducing downstream costs, whatever it may be. Because if the only barometer is, oh, our employees aren't complaining, that's not a great bar to set. So we'll see how we can incentivize companies to really evaluate their benefits leaders based on what strategic initiatives they're using and promoting based on those things. So really excited to see some of that innovation.
Yeah.
What's the biggest difference that you experience working for two early stage up and coming vendors and then working with a big nonprofit coalition that everyone wanted to be a part of? What were some of the expected differences and what were some of the unexpected ones?
Yeah, I think one of the biggest differences is that at the startup organizations, like you're laser focused on one thing.
Mhm.
And when we think about coalitions, whether it's New York or St. Louis or any of the others, there's so many things that we're touching on and that we're addressing. And, from the activities, whether it's educational programs, whether it's purchasing a product, whether it's a data initiative, whether it's sitting on the Chronic Kidney Disease Foundation's, work group to reduce kidney disease in the state of Missouri. And so you've got different levels of activity and different content, cost, quality, helping employers run their benefit programs most effectively. And then I run the organization. I'm the CEO, right? So I'm focused on the finances. I'm focused on our lease is up in a year and a half. I'm focused on, I want to change our fiscal year, you know, and I'm not qualified to be the CEO of a for-profit health plan digital startup, so being there, I was laser focused on, and it was sales, but it was like spreading this innovation across employers. And then the pressure from investors in the for-profit space and the board, huge. And in the nonprofits, I have to keep us financially afloat. I have to raise money. It's very much part of the job, but it's different. So those are two big differences, I would say.
Well, I think, your early years at the Northeast Business Group on Health prepared you for Centivo as well as Waldock because it's really like grassroots marketing, like getting people excited about a new concept.
Yep.
And so it's a skill, to be able to get people excited about something that wasn't necessarily on their radar or on their main priority list. And really getting them to see the world in a way where that should be, a large area of focus because it impacts, a lot of people within the population. So
Right.
at this point, you're leading the St. Louis Area Business Health Coalition as president and CEO. What is your vision for the coalition over the next 5 years? And, how did you get involved in the first place?
Person that ran it for 20 years, I've known her for, since my New York days, called me and said, hey, I'm going to be retiring and I want you to consider applying for the job. And, to be honest, I had been thinking about getting back to nonprofits, the nonprofit space. And when I thought about going back to a coalition, we talked about getting out of the comfort zone, right? I got out of my comfort zone to go to Welldoc and Centivo and stretch myself. I said, you know what? Maybe it's time for me to get back into my comfort zone
Yeah.
and what I know and what I'm comfortable with. And so I threw my hat in the ring. And I had never been to St. Louis before I applied for the job. I don't know why my work never brought me to St. Louis. I've been to Kansas City. I had never been here. But when I was at Centivo, I worked closely with the coalition in Milwaukee. And I got to see what a mid-sized city could do and have an impact in a community in a way that a place like New York could not have. And so
Yeah.
I was intrigued by the mid-sized city and the impact that you could potentially have.
Mhm.
And then there were a couple other things about the coalition. There are about 40 coalitions around the country, all
Mhm.
trying to, improve healthcare in the market. I wouldn't have gone to just any coalition. There were things about St. Louis,
Yeah.
and we'll talk a little bit more about these, but we have a product. We have a PBM product that our members purchase through us. We have a multi-payer claims database where we can measure quality and cost. So there were some very specific things here
Mhm.
that interested me coming to the coalition. In terms of my vision, I want to grow it. I think it's ripe for growth. And as a result, have a greater impact. Like the more employers that we have and the greater impact we can have. And impact for us is improved quality, cost, value of healthcare in the market and what employers are actually buying. And we have national and global employers as well as local employers. So we have Anheuser-Busch, we have Edward Jones, we have Panera, we have Drury Hotels, Bass Pro, Gray Bar, but we also have school districts. We
Mhm.
have the city of St. Louis County. So it's a really great mix of local, national, global. I want to make sure that we're providing resources and value to all those companies. And I want to bring, like, you have been in the innovation space, right, for many years. I have come from the innovation space. I feel like these employers need to be exposed to more innovation. And so
Yeah.
my goal is to expose them to innovation, new models, all the things that you talked about related to provider innovation, PBM innovation. So my focus is to bring innovation to the employers in the market and then use that again to improve the quality and value, of the providers and what the employers are buying.
That's fantastic. And I think, what a lot of like Rust Belt cities have in common is they're not necessarily destinations where people typically move there. And like it's not a transient city. Like a lot of the people that grew up there stay there. So whether we're talking
Yes.
about a St. Louis or a Milwaukee or a Cleveland or a Pittsburgh or a Detroit, a lot of influence can happen because like there's a lot of connections, there's a lot of community, there's a lot of relationships that span decades, not months or years. So I think that's why you can make a greater impact in some of these cities because
Yeah, we all live here and we all work here.
Mhm.
And different from like the New York example where I'm working with you in Manhattan, but we're scattering to 4 states when we go home at night.
Yeah.
And I have this funny story, which I think you've heard me say, Norm, but and this is a great example of we live here, we work here. So I'm here
Mhm.
3 weeks and I'm in the grocery store, on a Saturday and I'm at the deli counter and all of a sudden I hear Laurel. I was like, who could possibly know me? I've been here for 3 weeks and I turn around and it's my board member from Mercy Hospital. Like, oh, hey, Dave. And he's
Love
like
it.
picking up bagels for the family. And I had another example where someone invited me to go to music in the park, a friend of a friend. And we got there and the people are like, oh, what do you do? I'm like, oh, I run a nonprofit. Like, it's hard to explain what a coalition does. I said, what nonprofit? And I was like, oh, the St. Louis Area Business Health Coalition. He said, oh, you took over for Louise? I was like, yes, I took over for Louise.
Yeah.
I'm like, Louise? So it's just really has borne out that exactly what you said.
That's fantastic. I love that. So, how does the Business Health Coalition impact its members today? And, what are the plans for the future?
Yeah, I think one big area, and this is with really all coalitions, is that we provide education and networking. Like those are the foundational coalition activities. We want to make sure they have resources to run their benefit programs most effectively and that they can learn from other employers. And that's a huge value that we bring. We have a PBM product that they can purchase PBM through us. We partner with Express Scripts, who has been the hometown PBM. Obviously, things have changed a little bit with the Cigna relationship, and we also have CVS as well. So a purchasing product that they can save money and we can be their advocate. But then, Norm, there are the things that we do behind the scenes that
Mhm.
help them fulfill their fiduciary responsibility, like the reports on the quality of the providers in the market and costs. And we actually sit down with the medical groups and we go over their quality and we say, hey, this is where you're doing well, this is where you're not doing so well. We ask hospitals to fill out the leapfrog survey to show us how they're doing on patient safety and to focus on patient safety. So there are these things behind the scenes that we're helping employers fulfill that fiduciary responsibility. Are we offering quality healthcare, quality benefits at a reasonable cost, right? A cost is always part of it. So it's twofold. It's like give the employers what they need to run their benefit programs, but then, help them on the back end, evaluate the system, move it along, toward greater value.
That's great. How does your organization focus on policy advocacy?
Yes, policy is a big part of what they do here in the St. Louis Coalition. We didn't do as much of it in New York, to be frank, but we look at legislation here and how it impacts our employers, both state
We're
and
talking at the
federal.
state. Okay, that's what I was going to ask.
Yeah, both state and federal, because there's lots of legislation now and bills that are popping up, whether it's related to PBMs, obviously, or like some of the things we're seeing with hospitals, like sites of service, site neutral payments. Fortunately, there are things that are going to have to be legislated that have to be stopped that, you can't do sitting around a multi-stakeholder, table. We want to be tracking what's going to impact employers and their ability to deliver the benefits to their employees most effectively, and see how we can influence them and educate legislators. Sometimes they don't know. They're covering every issue that there is, and they don't sometimes know what's actually happening in healthcare or how this little thing affects, these people in this way.
Well, I think we've already discussed there's usually a very far gap between what the software vendors are like very incentivized by and what they're trying to push in terms of innovation. And then what the actual employers are asking for and hoping for. You have the inside baseball. I'm like, what are these employers asking of you and your coalition? And what were they asking for in your Northeast business group on health days? If you had to answer what are the 3 to 5 biggest priorities for employers right now that they care about, what would you say?
So, it's still cost. It's still moderating the cost, right? That's the overall priority. They are very interested in the employee experience, making sure the employees are having a good experience in the healthcare system and interacting with the benefits. They're also very interested in improving the health of their employees, and been meeting with all the members as I've gotten here and many focus on prevention and primary care. And, when I think about all the solutions that you work with, Norm, and that, I've known, I feel like things are shifting a bit. And I know you're familiar with the phrase point solution fatigue.
Oh, yeah.
And I think employers are having point solution fatigue. Although I have to say the St. Louis employers, I think there's a market here still in St. Louis. So you can tell your companies, I think we have some opportunities for point solutions here, especially around mental health. But for the most part, a lot of them are the big ones, like Boeing. Boeing is a great example. They're one of our very active members. They're focused on primary care. And you know what? Let's let the primary care physician manage the care and not layer on a bunch of point solutions. And that was the Centivo model as well. Let's let the primary care physician manage care. So Boeing is very focused on advanced primary care. And so where I think the point solutions need to go, and some are already headed this way, is integrating with medical care and being a tool for the physician, being a tool for the health system, for the benefit of the employee. Absolutely digital health. We need digital health solutions. We need apps. We need, when that patient leaves the doctor's office, what help do they get? And how can the doctor keep track of what's going on with that patient? So I think there's absolutely a place for those solutions. And I see them being integrated into medical care in the future, as opposed to employers sort of one-off buying them. And then one more thing employers are focused on, I ask them about the conditions, like what conditions do your employees have costing the most? Cancer. It's like number one for almost all of them. And that wasn't always the case, right? It used to be diabetes, cardiovascular disease, musculoskeletal, they're in the top 5. Cancer is the top of list for every employer.
Yeah, absolutely. What are the employers hoping the vendors stop doing?
They do not believe that the ROI that they're selling is accurate.
Hmm.
So I think that's the biggest thing I hear is you cannot really tell. It's hard. It's not. They're unsure if it's believable about the ROI. I feel for these vendors. They have to show an ROI, but then you get
They don't believe
criticized.
you
Like they don't
share it.
believe you, and it's
So how do we build more trust? Like, how do we build a little bit more open-mindedness on the employer side? How do we maybe incentivize the vendors to be more transparent?
I think it goes back to, and I know it's a chicken and an egg. I think you need to have example and case study. And I think vendors can try to, focus on like I had a vendor in my office this morning and said, "Hey, can we find one employer you might be interested that we could do this for a year?" And I think finding those pilots and
Yeah,
those employers that are for some reason this is an issue for them and they're willing to step out of their comfort zone and try something. And you know what? Maybe it's at no cost to the employer, but it's
yeah,
something that the vendor needs to invest in to have that proven case study. I think it's hard otherwise, but I think that's where employers struggle is with the ROI. Now, some employers, the ROI is not as much of an issue, right?
yeah.
They want their employees to have the service. They want them to have the solution. It's about culture. And in some cases, you find employers that are there, but many
Hmm.
of them are struggling with, I don't know how to really understand the ROI. And I don't know if I believe it.
Yeah. What are your predictions in the next decade for the vendor slash employer relationship?
So I mentioned already, I do believe that the point solutions, are going to become more integrated into medical care. And the ones that really work will emerge and a lot may fall away, that model. So I think we're going to see more integration there. Virtual care and digital health will still be critically important. It's now how we do things, and people need those options. I hope that the Centivos of the world will get more traction and that we'll have
Mhm.
more alternatives to the big nationals. They certainly play a role and are needed. But I, of course, want to see more direct contracting. But you alluded
I
to that
love it.
before. I want to see more
That's
direct employers directly contracting with health systems, and health
Whether
systems
that's
want to see that
directly
too.
or through vendors, I
Mhm.
agree. There needs to be companies that find areas where health plans are just not providing their employer clients great value
Uh,
and calling that out, saying, hey, like, you had the opportunity, you didn't give us great pricing. There's groups or ourselves that can negotiate better rates. Sorry, like you can get 60% of our business, but the 40 that was costing 80%, like we're going to take on
yeah,
ourselves.
yeah, and I think people like us need to be really pushing the employers along and toward these new models.
I love that. That's great. I think it's really important in healthcare that like all of us that are doing it professionally also practice what we preach. So, you're in a stressful job. You just took a new job. You're trying to, really make a lot of things happen in a short period of time. How do you reduce stress? Like, how do you stay top of your game, under a lot of pressure?
So I think, exercise is a big part of that. And for me, anyway, that's a good go-to.
Do you just like
I
walk outside or like what type of exercise keeps you?
Well, I'm a Peloton user, but
Love it.
my Peloton is not in St. Louis yet. So I'm using my Peloton, but what I have done is, to your point, I've taken up more walking. You learn more and more how much walking is good for you, and I actually have I walk to the office sometimes. So I live about 5-minute drive or so from the office. It's a mile and a half and it's a 35-minute walk.
Yep.
And so the days that I'm not traveling about meeting with members, I walk to the office. And so then I could get about 3 miles in just walking to and from the office.
Love it.
And then I love hiking, and I've been exploring some parts of Missouri. I went to the highest point in Missouri this past weekend and did a hike
Mhm.
there. So that was really fun. Getting outdoors. Yeah.
That's tremendous. And then I think obviously very important thing with managing our health is what we're putting into our bodies. I think people really struggle sometimes because in the US sometimes it's hard to decipher what's healthy, what's not, depending on what fad diets out there and what
Yes.
corporations are trying to sell. So any healthy recipes you make at home that might inspire someone to try something new that they haven't tried before.
You know what my go-to is, Norm?
Let's hear it.
Salmon in the air fryer.
Okay, I like it.
So
Any
maybe
seasoning or just like lemon, salt? That's it.
no, I use like that, like the soy vey or at Trader
Oh yeah.
Joe's. It's like the teriyaki. It's so easy. I just put it on the salmon and you stick it in the air fryer for 10 minutes. And it's such an easy, healthy go-to. And I think salmon has always been considered healthy. It has,
It.
and to your audience, something new they could take from that possibly is that if you haven't done salmon in the air fryer, it is the best way to cook salmon. It gets crispy, the skin gets crunchy. And I discovered that, like, oh my gosh, this is my go-to. And, it's so easy. Highly
How
recommend it.
long in the air fryer at what temperature?
400 degrees, about 10 to 12 minutes, depending on how big and thick your piece of salmon is.
All right. I'm going to throw this out there. My wife loves making salmon. We are going to try the air fryer now. She's used it in the oven. She calls what she puts on top of it like a char crust. It's like
Oh,
buy it in the grocery stores and it's like not a wet marinade. It's like a dry rub and that's really good on salmon. She
and you'd
makes like
recommend that?
it's really good. Yeah.
All
No,
right.
I like teriyaki. Try it and see which one you like, the dry or the wet, but both really, really good. All right. Well, Laurel, thank you so much, for giving us these amazing insights and the very helpful recipe. I'm going to try that this week. So I really appreciate that. And again, congrats on all of what you've built so far at the Business Coalition in St. Louis, and excited to see what else you're able to accomplish over the next bunch of years. So
Great. Thanks, Norm. This is really fun to talk
yeah,
about my journey. I don't get
it's
that
it's a
opportunity too
great
much.
journey, and it's I wouldn't say it's only beginning, but you're just getting started in St. Louis. So again, thank you
Right.
for joining on the Digital Health Heavyweights podcast, and we're going to be watching what St. Louis does very closely in the coming years.
Great.
Thank you. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.